All right. Good morning to all the possum pet parents out there. It's another beautiful Saturday morning, and none is going to stop us from sharing to you great tips in raising your fur kids to be that one tough doggo here in Maxime Talks. So, once again, I am Dr. Renil Montero, your host for this morning. So, for today's episode, we will be talking about doggo healthcare. All right. Everything that you need to know when it comes to healthcare during the puppy stage, adulthood stage, and of course during the geriatric phase or the old age of your dogs. But of course, we're going to cite examples of the most common ailments that they're facing during those stage. But this episode won't be complete without, of course, ang representative ng Pet Parents Association, right? Let's all welcome back Dog Coach Francis. Hello, Coach. What's up? And good morning.
Hello, Doc Roniel. Na-miss ko itong webinars natin, no? Itong mga talks
Yes.
natin. So, hello, pet parents. I hope you can join us on this episode of our webinar. Actually, parang ano nga eh, parang medyo video podcast na rin yung dating, no? So,
Yes, that's right.
because we want to be talking to you directly, so join us in the chat box kung meron kayong mga tanong. And maganda yung topic natin ngayon. Ako mismo, I'm so excited kasi not only that I have puppies, I have adult dogs, and at the same time, I have senior dogs. So lahat, interested akong matuto.
Yes, that's right, Coach. Itong topic natin kasi today, we will be engaging more general lang naman yung approach natin. I'm so sorry guys if hindi natin siya magiging specific yung approach, but you can always ask questions on the comment
Mhm.
section below and sasagutin namin yan right there and then pagka-post niyo ng questions niyo. All right.
Yes.
So Coach, I think we should start this one.
Yes. So, teka. Ayan we're gonna be talking about, well, for, uh, hmm, teka lang.
Yes, Coach.
Teka lang. So Doc, here's the thing. Let's start with the puppers, okay? So I bet there are a lot of pet owners out there who worry about every little thing their puppy does. So what are the first thing a dog parent needs to know when it comes to puppy healthcare? Ano ba yung mga yon?
Yes, that's right, Coach. For our first lesson, we're going to talk about the puppy health care. So maraming bagay dyan eh. I mean, owning a puppy doesn't end in getting the puppy home sa pagka-uwi. Okay, may puppy na ako. Hindi doon. So, mag-start ka pa lang doon and marami ka pang dapat gawin. So first
Mm-hmm.
things first, vaccination, Coach. Vaccination and deworming. All right? So previously, we were able to touch this on a more specific approach with Doc Jomar. So that's our first episode. We tackled on the 5 diseases na nandito sa
Mm-hmm.
vaccination na yon. So let's talk about ano nga ba importance ng vaccination at bakit ito kailangan gawin on your puppy. All right? So the first thing is that we should know kung ano yung mga diseases na nandoon sa vaccine, kung ano yung vaccine, and kung kailan sila binibigay, how often. Alright? On this form below, makikita natin na we have two core vaccines, right? So first is
Mm-hmm.
the 5-in-1 vaccine. Ano yung mga diseases na nandoon? There is canine distemper, canine parvovirus, hepatitis, leptospirosis, and para-influenza. So, kailan nga ba mag-start ang unang shot nito? Dahil yun yung unang question na madalas ko nakikita sa mga Facebook page groups na ating mga pet parents. So,
Correct.
first shot will start on 6 to 8 weeks and followed by its second shot at 9 to 12 weeks. Then next, third shot is on 12 to 14 weeks. And the last shot is on 15 to 17 weeks. So tandaan nyo na dapat meron silang 4 shots of 5-in-1 to complete their vaccination for the first year of age ng dogs ninyo. Okay? At hindi pa din nagtatapos, you have to engage on revaccination or tinatawag natin na booster on a yearly basis, Coach.
Right. Doc, meron akong question kasi in my
Sure.
experience din, meron mga puppies na gustong magpa-train sa akin. Hindi ko tinatanggap pag
Mm-mm.
hindi pa complete ang kanilang mga shots, no. Pero
Yes.
meron akong mga napapansin, pag tinitignan ko yung mga ibang booklets nila, parang proof lang na their dog is vaccinated. Meron mga iba doon na they don't have a signature coming from a vet.
Oh,
Anong opinion mo doon?
that's hurtful on my part. In behalf of
Uh-huh.
the veterinarians, masakit actually to see those kinds of vaccination records that aren't administered by veterinarians. That's really risky. Why? Why risky? Unang-una sa lahat, we are not so sure on the handling of the vaccine, 'di ba? So the vaccines are usually kept on cold storage, 'di ba?
Mm-hmm.
If it's not handled carefully, vaccines might, mawala ang effectivity. That's one. Second is on the administration of the vaccine. Some dogs elicit allergic reactions on vaccines. So if it's not given by a veterinarian, most likely magkakaroon ng more adverse or hindi maagapan yung allergic reaction that could lead to death eventually because
Mm.
hypovolemic shock, like that. Then third, of course, before we give vaccination to a dog, we usually check the temperature of the dog if
Right.
it's on the normal range because we do not vaccinate sick dogs. All right? So that's very alarming, coach, to see that, 'di ba?
Pati yun ano,
But
'di ba, Doc?
yes,
Yun
coach.
parang span, parang okay, from the first shot up to the
Yes.
second kasi pinaplano talaga ng isang licensed vet 'yan. Now,
Yes, that's
ang
right.
ginagawa kasi ng mga iba, parang minsan magkakasunod o parang hindi
Mm-mm.
naglalapse. So, walang
Yes.
overlapping talaga ng mga vaccination records which also invalidates that. Tama?
Mm, tama coach. Ang legit na vaccination card, mamaya meron tayong example on what it looks like. Para lang din alam nating mga pet parents kung ano ba yung legit sa hindi legit. Okay? Ang
Yes.
tendency kasi pag for example, meron mga puppies na nagpupunta sa clinic and meron ba silang dalang vaccination cards pero hindi naman veterinarians ang administer, the
Mhm.
tendency is uulitin namin yung vaccination. Alright?
Yes.
To make it sure na tama ang pagkakabigay natin ng vaccine. Alright? Okay, so, yes, coach. Yes,
Yeah,
coach?
I'd like to say hi to one of our viewers right now of the webinar live stream, si Alvin Mangubat. Hello, sabi niya, hi
Alright.
po, good morning everyone. Thank you for joining us, Alvin. If you have any question, please comment
Yes.
below. We have a wonderful topic for you. Actually, lahat ng age group, no, pasok dito sa webinar na to with Doc Roniel. And
Yes,
we'd be
that's
happy to
right.
chat with you. Diba? Kung meron kayong comment, sabihin nyo sa amin. All right. Anong
Yes. Thanks,
susunod, Doc?
Alvin. Of course, next after 5-in-1, after matapos lahat ng shots for 5-in-1, andyan na si rabies, okay? Anti-rabies vaccine. So this is very important vaccine na dapat hindi nawawala sa healthcare checklist ng lahat ng puppies or lahat ng may aso. It is given only one shot for the first year at 3 months of age. And yearly booster na to. Alright? So dito sa Philippines, hindi pa eradicated si rabies. So I am encouraging everyone to please have your dogs vaccinated with anti-rabies. May mga free na anti-rabies na kinakandak ang PVMA, ang mga municipal vets natin, even other clinics, even other pet care company, they are giving out free anti-rabies vaccines. So please take opportunity of those things. All right?
Correct.
Yes, coach.
Yung nga no, medyo nakakalungkot na parang para sa isang bansa katulad natin na hindi pa
Mm,
na-eradicate ang vaccine, ang
ang
rabies. If
rabies.
you think about it, it's so easy. 'Di ba? Kung kayang gawin ng European countries 'yon kasi you don't need anti-rabies kung tutuusin no. Pero
Mm,
yung nga if siguro we can just spread the word dun sa mga kapitbahay nyo na merong puppy, 'di ba? Sabihin nyo, na-vaccinate na ba ng rabies yan? Kasi rabies is very dangerous, di ba? Walang cure. And it's a
yes.
sad thing na makakita ng isang tao na na-infect nun kasi it's just super horrible. Pero a simple yearly vaccination, at least yun standard sa ngayon, di ba?
Yes.
It can protect lives already. Not just your puppy or your dog, pero human lives.
Definitely, definitely.
So, medyo, yung mga anti-vaxxers dyan, di ba? Magbago na kayo.
May gano'n din pala sa puppies 'no, coach, mga pet parents na anti-vaxxers. But
Oo.
guys, Oh, we have a question here
Yeah.
from Ayan Lorenzo. Okay. Hi, Doc.
Yes.
Yes, sana hindi nag-administer mga hindi vets. But if you have to revaccinate, wouldn't that be over-vaccinating? That's a good
Ah.
question. All right.
Yes.
So, uh, I can say na it's a benefit of the doubt. What if yung nag-unang nag-administer is hindi proper yung administration?
Mm-hmm.
So, anong gagawin namin as veterinarians? All right. So, yun yung parati namin iniisip na what if hindi maganda yung pagkaka-vaccinate nito? Susundan lang namin to? Definitely not. We will do it again and again to make it more official and to make it more safe for your dogs. Kasi baka hindi naman naka-uptake doon dahil yung vaccine na ginamit is already warm, so wala na siyang efficacy. So, uh, yun, to benefit of the doubt na lang din, we need to revaccinate them again. All right? I
Mm-hmm.
hope I answered your question, Ayan Lorenzo.
Yeah.
All right?
That's a wonderful question, Doc, no? So,
Yes, that's
generally,
right.
mura lang naman ng vaccinations, eh, no?
Tama.
By weight naman ito, no? So, it's always better that we err on the side of caution.
All right, coach. All right, I
So,
think on
saying hello din kay Roy Baay. Sabi niya, good morning po, Doc. And then meron
Hi
din
Roy, good
comment
morning.
si Arjun kanina, si Arjun
Mm-mm.
Francis. Wow, thank you for hosting this, Maxime. Hi, Doc Niel and
Oh,
Coach
hi.
Francis. Ayan, thank you so much,
Yes, I
Arjun.
hope you're enjoying our episode for
Yes.
today.
Hoy,
Um,
yung mga ibang nanonood, don't just watch there. Interact with us. We want to know. Mag-hands up
yes,
kayo. Show us an
ask question.
emoji. Ask questions. Mas maganda para maging interactive ang ating webinar ngayon or ang ating Maxim Talk. O sige, Doc, anong sunod na
Definitely.
pag-aaralan
All
natin
right.
or pag-usapan?
Eto na, sa next slide natin, coach, makikita natin yung legit na vaccination and health card,
Yan.
okay? So, eto yung ibig sabihin ko pag sinabi kong legit vaccination health card. Be worry of the things na nandito. So, on the first column, there should be the vaccine given or the sticker.
Mm.
Usually, yun yung dinidikit ng mga veterinarians on your vaccination card, plus yung lot number. It is indicated there. Next is the
Oh.
date ng vaccination administration, kung kailan in-administer, and followed by the date of the next schedule. Alright? Nandiyan yun. And finally, on the last column, you should find there the name and the signature of the veterinarian with her or his license number. Alright? So, yan yung composition ng isang legit na vaccination and health card.
Yan, Doc, ito
Yes.
yon. Minsan
Yes.
walang signature ng vet. Minsan initial lang kung sino man nag-administer niyon para masabing nabigyan ng vaccine. And usually,
Yes.
connected din to with our previous webinars na
Mm.
pag hindi professional breeder or hindi ethical yung breeder, they just administer it themselves kasi nagtitipid sila ng vet fees eh.
Mm.
Di
That's
ba?
right.
So,
That's right. That's right.
pero that's very scary for the dog. And for the humans eventually, pag nakuha nyo na yung puppy at may sakit.
Definitely. Definitely, coach. Yun yung ano eh, side effect, kumbaga, ng hindi licensed veterinarian yung mag-a-address ito. And bukod dyan, it's against the law. Alright?
Oo.
Okay.
Yan. Emil Corpus says, nakaka-excite mo no. Thank you so much, Emil. Kung meron ka tanong,
Oh,
please, ask Doc Ron or if you have a question for me, pwede rin naman. Though,
yes.
ang talagang pinag-usapan natin dito is about healthcare ng aso. So, si Doc Ron talaga mas nakakaalam sa atin. Sa
Yes.
akin, experience lang.
Yes. Actually, coach, yan, si Emil Corpus is actually a veterinarian too. He's supporting us,
Oh!
yes, with our
Wow!
product, with Maxime, and of course, our vision to, to share how to properly care our dogs.
Of
Yes.
course.
What's
Hello,
up, Doc
Doc.
Emil?
Hello,
Yes.
Doc Emil. Yan. Maganda to, no? It's very important na magkaroon, this time around, magkaroon ng talagang mesh between the veterinary community and yung mga dog training
Hmm.
services or mga grooming. Kasi lahat tayo magkakasama in providing better service and care for our doggos. Very important. Just like what
Yes.
Maxime is doing now, with sponsoring these webinars, di ba?
Definitely. We are partners here. The veterinarians, the breeders, the trainers, we are all partners here.
Mm-mm.
Okay? Always
Mm-mm.
remember that.
All
All
right. Good
right.
morning, Doc. Sabi ni The Answer, Kanyada. Hello to
Good
you,
morning
sir.
too. Thank you
All
for
right.
tuning in. All right, Coach, hindi lang vaccination. All right, for this next slide, we are going to talk about the deworming protocol. All right,
Mm-mm.
so first deworming schedule is on the second week of age nung puppy. Hindi mo masyadong bata? Hindi, tama lang. Second week, and then followed by fourth week, sixth week, eighth week, and every 3 months thereafter. Sobrang daling tandaan, that's 2468. Di ba parang dial 2468? Alright?
Right.
Kasi
Parang delivery lang.
yes, coach. Eto rin yung madalas na tinatanong ng mga pet parents natin. Kailan ko ba dapat i-deworm yung aking alagang puppy? Ayan na po. So it should start at second week, followed by fourth week, sixth week, and eighth week, and then every 3 months na. Actually, it depends upon the diet of the dog and the environment he lives in. Yung regular deworming. It could be 3 months or every 6 months, ganyan. All right?
Alright, Doc. Ano yung
Yeah.
effect pag na-miss nila yung deworming? Kasi meron ako mga ibang experience
Mm.
dyan, yung mga ibang puppies na nakikita ko. Sabi niya, ito ang taba-taba, laki-laki nga ng tiyan.
Ah,
Nawo-worry ako doon. Sabi ko, teka, baka yung more worm na yan, dalhin mo na sa vet para ma-deworm. Ganun ba
nako
yon?
coach. Nako coach, later meron tayo diyan topic about intestinal parasite. So,
Oh, yan.
makikita nila kung cute ba yung pot-bellied kong puppy.
Oh my God, di ba?
Yeah, tama po. Okay, for next slide please.
Yeah.
Yan. For konting reminders lang from our vet friends. Friendly vets. Alright, so of course, your veterinarian will always ask you to not bathe your dogs 3 days after vaccination. Madalas nyo tong naririnig no na, Sir, bawal po munang paliguan ng 3 days, ganyan.
Meron pa
So,
nga isang linggo eh.
so nagtataka kayo minsan bakit kailangan hindi paliguan? Kasama po ba yung owners doon? Siyempre hindi. So, dapat maligo yung owners everyday. Pero yung puppy natin, after 3 days tsaka lang siya dapat maligo. Alright. Good
Ah.
morning to Ferdinand Sugar de Leon. Thank you
Hello,
for tuning in.
Ferdinand. Ito pa, si Ordonez Chris Dongan. Ang haba naman ng pangalan mo, my dear. Hello,
Yes.
Doc. Pwede ba isabay ang anti-rabies and NexGuard Spectra? So, pwede bang isabay ang anti-rabies at deworming sa palagay ko? Kasi this is a brand,
Yes.
pero
Yes, yes, yes.
deworming in general.
Usually, it could be given ng sabay. Pero again, it is the discretion of your veterinarian upon assessment. Kasi ito-check pa yung dogs ninyo eh. Marami pang checking yan. Ito-check if nasa normal temperature, like that. Then bago magbigay ng vaccination and deworming. Kasi it's additional stress to the dog. But technically, pwede naman siyang ibigay ng sabay. Alright? Thank you for
Mm-mm.
that question. Yes. Okay, so number two, bakit nga ba hindi dapat paliguan? Because it is a stress for your dogs. Dito sa Pilipinas, mainit yung panahon. So, after vaccination, and then papaliguan mo ng medyo cold water, it's a stress. So, any stress can actually affect yung vaccination uptake ng aso. Alright?
Mm-hmm.
So next, yun nga, prevent stress your dogs because it might affect vaccine uptake or vaccine take-up. All right? The next, do not walk your dogs outside if
Mm-mm.
vaccination isn't fully completed. Paulit-ulit natin tong sasabihin. All right? Okay, cute sila na dalhin sa mall, ilakad-lakad, suotan ng damit.
Excited sila eh. Excited silang
Yes,
ilabas yung
go.
puppy.
Mm-mm. We understand the excitement. Even ako excited din na makita yung mga puppies outside. But it's risky, all right? If hindi pa kompleto yung vaccination, they might get the virus that could infect them and then later on magkasakit sila. All right?
Mm-mm. In
So
connection with
that's
that, Doc,
important. Yes, Coach.
kasi coming from the dog training community rin
Mm-mm.
naman, um, dito na pumapasok yung lagi namin sinasabi, na advice even with my clients, na
Mm-mm.
vaccination and socialization goes hand in hand. It should be
Yes,
balanced.
definitely.
Diba? Don't forget about the vaccination, pero wag niyong itatago yung aso niyo sa bahay lang, hindi niyo na talaga ilalabas. Kasi
Mm-mm.
baka paglaki niya, hindi naman siya socialized, aggressive na siya. So, you have to really plan out your socialization and your vaccination. Find a balance between the two of them. Tapos, the earlier that you get your dog vaccinated, syempre, the earlier mas magiging safe na i-socialize yung aso nyo.
Definitely. You should follow the schedule. Kung
Mm-mm.
gustong-gusto niyo nang ilabas yung aso ninyo, you should follow the schedule. As early as 3 months to 4 months, you can actually bring your dogs out to the public. 'Di ba?
Right.
Palinas
Yeah.
ni Gala.
Do
All
not
right?
delay.
Yes, that's right. And finally, only veterinarians can administer vaccinations to your dogs. All right? So, all caps yan, veterinarians, guys.
Oo. Ako, fully support ako sa vet community natin. Ako, ang dami kong
Yes.
mga
Thanks,
nakikita, mga
coach.
cards, health cards. So, hindi ako
Mm,
magsisimula mag-training kung hindi ko nakikita yon. And, nako, lalong-lalo na kung bibili nyo doon sa mga pet shop na iba dyan. O, diba? I
yes.
don't care kung magalit kayo sa amin ni Doc. Bawal po yan.
Bawal talaga yan. Actually, just wanna share na ang dami namin na-experience recently na mga health cards using the name of other veterinarians.
Ah,
Mahuhuli
yes.
mo lang siya na wrong yung license number niya kasi umaabot na ng 100,000 yung license number. There are only 10,000 something veterinarians here in the Philippines. Pero yung license number niya is 100,000. Pero yung, yes coach, pero ang ginamit niyang name is a licensed veterinarian. See how disrespectful they are,
Meron din ako
right?
nakita naman. Pangalan mismo ng breeder. Nakatatak.
Alright.
Tapos, pirmado niya.
Yes, actually common talaga yan coach on the practice. And um,
Nakakalungkot.
nakakalungkot talaga siya and sobrang masakit on our part as veterinarians. So
Mm-mm.
please, only veterinarians can administer vaccinations to your dogs. All
Right.
right?
Don't risk it. Yes, Doc.
Yes, don't
Anong
risk it.
sunod?
Alright, next natin are common ailments na na-encounter during the puppyhood. Okay, for the answer kanya, I think may question siya.
Yeah,
Do we
sabi
have to
niya,
consider what type of vaccine we administer depending on the breed of my dog? No. It's vaccines are not breed predisposed. So they're not breed specific. So any breeds, iisa lang po yung ginagamit natin na vaccine dyan. Alright? So walang for poodle, walang for shih tzu, walang for chow chow, walang for Belgian, wala pong ganun. Alright? So it's all good for dogs.
all good for Dogo. It's
Yeah.
Canis lupus or Canis lupus familiaris. So they
Yes,
are
very
of the
good.
same family. Hindi po kailangan na iba-ibahin yan. Yun sa
Definitely.
humans, medyo may halong politika lang yan. Pero wag nating haluan ng politika, yun mga dogs,
Huwag na
because yun
nating
lang naman
idamay.
importante.
Tama.
Oo, oo.
Definitely. All right, coach, for our first ailment na common sa puppy, ito na yung pinag-uusapan natin kanina, mga pot-bellied puppies, hindi pot-bellied pigs,
Ah,
pot-bellied puppies, right? The intestinal parasites. Ito yung mga worms inside our dogs. Okay, so many puppies may become infected with intestinal parasites prior to birth or shortly afterward during nursing. So how is this so? There are internal parasites or worms that could be passed through or naipapasa ng mother sa puppies nila transplacenta. So sa placenta dumadaan siya. Okay? Meron din naman transmammary. So ibig sabihin nun, ipapasa siya through mammary gland or through the milk na nasisipsip
oh.
ng dogs. Alright? So those are the common pathways. Pero pwede rin naman na nakukuha ng puppy upon licking the surfaces where na nakakapupo yung aso nila, yung inahing nanay. So those are the three pathways kung saan nila nakukuha yung mga internal parasites nila. Kaya nga natin sila sinisimulan at second week for the deworming. Because pag kapanganak pa lang nila, dede na agad sila sa nanay nila and they might get worms or eggs doon sa milk ng kanilang mommy. Alright?
Oh. So Doc, ito hindi to kayang labanan ng natural antibody ng mom. No? Parasite kasi talaga to. It's a completely different thing. Am I correct?
Yes, definitely. Actually, pwede naman siyang ma-prevent. You can deworm your the mommy, the mommy dog before siya manganak. They can do that naman to prevent this one. Pero
Mm-hmm.
that's only contributing to at least 60% of the prevalence of this. So
Mm.
again, kahit nakapag-deworm si mommy dog, you should still follow the deworming protocol at starting at the second week of age of the puppy, right?
All right.
All right. So, okay.
Got it.
Eto na. Some people find puppies with roly-poly tummies to be so cute, adorable, parang pot-bellied, pero they are not. They're not cute. And it's a good manifestation that your puppy has internal parasites, guys. Huwag niyong panggigilan. Hindi sila
Meron bang mga
cute.
puppies na namamatay because of these parasites if not caught early?
Yes, definitely, coach. Um, Well, the risk is high for this one, especially if makikita natin 'to sa mga stray dogs, stray puppies who was, sobrang laki nung tummies nila.
Mm-hmm.
Of course, it will start from, paglaki ng tiyan. So, ang mangyayari, instead na yung kinakain nilang food, yung nutrients nun is napupunta sa kanila, it's napupunta sa worms. So, nagkakaroon sila ng malnutrition, heavy malnutrition, and then it can lead to death eventually. Of course, hindi na sila makakakain ng normal. And then, magiging immunocompromised na sila. Their immune system will become uh, more fragile. So,
Mm-hmm.
tatamaan na sila ng different diseases and then it will contribute to death of the puppy. So, ganun yung
Ayan.
practice niya.
Mm-mm. So batiin ko lang kanina, finlash na
Yes.
natin sa screen pero that was Gems. Ayan, si Gems
Yeah.
Dineros, good morning. Watching all the way from Katarman, Northern
Oh,
Samar. Hindi pa ako
what's
nakakapunta
up?
dyan.
Ay, ako
Gusto
din,
ko pumunta
coach.
dyan.
Let's go.
Mm.
Let's have the Maxime Talks there.
Oo,
All
pag
right.
pag na-vaccinate na rin ako kasi ako magva-volunteer ako ma-vaccinate ako kung libre.
Ay, ako din.
For
If
COVID.
it's free, go.
Mauna ako. Hindi
All
ako
right.
natakot dyan.
For next slide natin, intestinal parasites. Eto, I'll share with you yung mga kinds, typical worms, and typical uh, protozoa. I'm sorry, medyo typo yan. So intestinal worms, roundworms, hookworms, whipworms, and tapeworms, and protozoa, giardia, and coccidia. So these are the common intestinal parasites that could affect your puppies or your puppies. So common symptoms, ano yung una natin makikita? First, of course, diarrhea with or without blood or mucus. Pwede yun. Minsan may blood, minsan may mucus, minsan both. Okay? Scooting, ito yung anal scooting na tinatawag
Mm.
natin. Yung ginagamit nilang pangkamot or paano ba yun sa Filipino? Yung sinasadsad nila yung puwet nila sa buhangin. Makikita mo na lang merong trail ng pinagkamutan nila. That's what we call anal scooting. Alright? So next is vomiting. So pwedeng mag-induce ng vomiting ito. At some severe cases, pati yung worms binavomit na ng mga puppies. Alright? So next is dull coat. So this is a good manifestation that your dog or your puppy is suffering from intestinal parasitism if he has a rough coat. Next, ito na yung distended abdomen or belly, heavy infestation of internal parasites. Weight loss. Imagine, ang laki ng tiyan pero may weight
Right.
loss
Right.
because hindi na nakukuha ng tamang nutrisyon nung aso, yung dapat na nakukuha niya sa food na kinakain niya. Because hindi niya na yon na-absorb. It is being absorbed by the internal parasites.
Mm-hmm.
So next, decreased activity. So technically, yung mga asong may internal parasites, sila yung malamya, matamlay, they're so weak, they are not moving actively around. They're not playful. So if you see all of this, you can consult agad-agad of the veterinarian. Schedule an appointment to your vets and have it checked. All right?
Right. Doc, so ito, from our
Yes.
experience, yung mga nabanggit mong
Mhm.
symptoms, medyo nakakatakot to. So especially yung mga bloody stool o kaya yung lethargy o yung nawawalan sila ng energy or decreased activity
Yes.
na sa slides natin. Medyo kinakabahan na kami kagad yan. So dinadala na namin dun sa vet. So we can perform usually yung mga stool exam. Tama ba, Doc?
Yes. That's
So
right.
para sa mga
Pag
hindi nakakaalam paano ginagawa yung stool exam.
We have this called fecalysis ang tawag dito. It's either you bring the stool to the clinic or bring the dog. Actually,
Mm-hmm.
much better if you'll bring your dog to the clinic and we will get the fecal sample from your dog. And we will check it under the microscope to check for eggs. Hindi worms yung makikita namin under microscope, guys. It's the eggs of the worms. So from there, we will diagnose it and we will check which specific worm is this. All right. If it's
Mm-hmm.
combination of several typical worms, then we will give the specific dewormer for that. Pero,
Mm-hmm.
take note, hindi basta-basta binibigyan ng deworming or dewormer ang isang aso na nagsasuffer ng intestinal parasitism. Why?
Mm-hmm.
Because giving dewormer to a puppy is super stress for them. So, ang
Mm-hmm.
tendency is to give them muna multivitamins, okay, para maka-recover sila. And then, we will recheck it again, we'll re-examine if okay na yung katawan niya to conduct deworming. But that's case-to-case basis. Kaya nga dapat you should bring your puppy to the vet and we will check it personally. All right?
There you
So,
go. Very interesting, Doc. Another note lang, side story, very
mm,
short.
sure,
Yung
sure.
Giardia na isang possible parasite na nakukuha ng mga aso,
Yes.
um, pag tinignan nyo sa microscope pala yan, parang meron mata or parang naka-smile na
Yes.
na parasite na parang hindi pero pag nakita yung Giardia doon sa gut ng aso mo, doon sa stool niya or fecalysis, it's not really a good thing because
Mm.
um is it gonna stay in your dog's body until parang you don't totally rid of it? Tama ba 'yon?
Um, Sometimes, coach, but that's not the total case.
Mhm.
Ito kasi nakukuha 'to usually 'pag hindi maganda yung hygiene sa water
Mm.
ng aso. So, nagkakaroon ng giardiasis ang tawag dun sa
Right.
sakit. So, yung tama si coach, yung itsura ng parasite na 'to under microscope is like an owl na nakadilat sa'yo, nakamulagat,
Oo.
parang telling you na, "Oh, na-infect ko yung aso mo because you're not cleaning properly."
Oo,
Gano'n.
nako, nako.
Yeah.
So, sabi nga, always consult with a vet. Huwag kayong pupunta sa Facebook at
Yeah.
magtatanong sa comment section.
Hmm.
Naku, tiyatawanan lang natin pero seryoso kami ni Doc Ron.
Yes,
Okay?
this super serious. Minsan, maliit na bagay pero sabi ko nga, ang mga severe cases ng diseases nag-start into small things. If hindi
Mm.
natin natutukan agad, naku malalala yan. Mas gagastos tayo. Right,
Alright.
coach? Oo.
Yes, got
So
it. Ano
yan,
susunod na pag-usapan natin, Doc?
eto. Pinakasikat 'to actually, next common ailment for puppy is, next slide, it's the parvovirus, canine
Nako, ito na.
parvovirus.
Ito na yan.
Right.
Sige.
So it's a highly contagious enteric viral disease caused by parvovirus and is common to dogs below 1 year of age. So usually puppyhood stage talaga yung tinatamaan ng parvovirus. But if you want a thorough discussion of this one, you can always watch our first episode of Maxime
Correct.
Talks. It is about parvovirus.
Mm-hmm.
Okay? So today we're just gonna discuss about the common symptoms, how siya napapasa, and the treatment plan. Pero the more specific, nando doon sa first episode natin. Okay, so you might want to check it out. Okay, coach, for the common symptoms neto, unang-una na dyan, of course, bloody diarrhea.
Of
This
course.
bloody diarrhea, it has a very distinct odor. Right, coach? Na-experience nyo na ba na
Amoy
magkaroon ng
malansa.
puppy?
Malansa na parang
Yes,
bagoong na
yes.
hindi mo maintindihan and you can't
Mm-mm.
miss it.
Yes, yes. Distinct yun. Pag naamoy mo, my God, parvo. Parang when we are still students na nasa internship namin, maamoy mo na lang siya, okay, parvo case to. Ganyan. And nasanay na kami na we are, you know, amoy pa lang malalaman mo na it's parvo. Ibig sabihin, nasa progressive stage na siya.
Mm-mm.
Okay? Pero aside from bloody diarrhea, we have vomiting, we have fever, of course, lethargy, yung sinasabi ni Coach kanina na general weakness of the body, anorexia or inappetence, ayan. Then weight loss, of course, weakness, and dehydration and depression. All right? Oh,
Depression, di ba? Yan.
hi,
Sabi ni
hi John
Johan
Rice.
Rise, can adult dogs still catch parvo? Wonderful question, Doc.
Yes. Yeah, that's a very wonderful question. Thank you for that very wonderful question. So this is also the same question, no, na na-receive namin on our first episode. Can adult dogs still catch parvo? The chance is low, but they can still be infected. Okay? The chance is low, but they can still be infected. All right?
Kaya
So,
mag-ingat pa rin.
yes, definitely. If hindi man sila ma-infect, they can be the source of infection. Okay?
Oh, all right.
Yes. All right. For the treatment of parvo, it's a difficult treatment plan for the veterinarians. Um, minsan may namamatay tayong pasyente, ah, medyo masakit yon on our part.
Of
Nakakaiyak
course.
siya na mamatayan ng pasyente. Pero
Mm-hmm.
syempre, the veterinarians will always have their own treatment plans.
Mm-hmm.
Kaya, um, pag nakita niyo pa lang na inappetent na yung aso ninyo, hindi siya kumain ng morning, hindi siya kumain ng gabi. Kinabukasan, please bring your puppy or your dog to the veterinarian para maagapan natin, para ma-check natin. Pag ganito kasing cases, veterinarians usually, yung process ng diagnosis nila, it will start from, of course, asking the history of the patient to the pet parent. So
Uh-huh.
please, if we ask you questions, answer us with all honesty kung ano yung ina-ask namin.
True.
Because hindi namin matatanong yung aso kung saan yung masakit, kung ano yung nangyari. We will always ask the owner. Okay, we'll take down note the history. Next is the diagnostic tools. We will get blood or we will get samples for uh, rapid test. All
Mm-hmm.
right? So pag lumabas sa rapid test that it is parvo, okay, we will do our treatment plan. We will confine your pets. We will do our best to save your pet. But of course, sabi ko nga, this is a partnership. So, bring your puppy agad once na makita nyo pa lang yung mga early signs, and we will do our best to save your pups. Because parvo is not a very easy disease to cure. Alright? Pero ngayon, medyo with the advent of technologies, our veterinarians are more equipped, more technically equipped on how to combat these diseases. Ang kulang na lang is awareness to our pet parents na dapat at the early stage of the disease, bring your pets to the veterinary clinic immediately. All right?
All right. Got it, Doc. Thank you so much. Ayan, parvo, nakakatakot kasi to. Pero if you are
Definitely.
fully informed, hindi kayo kailangan mapraning. Just get your dog vaccinated and then keep your
Yes.
dog away from other dogs na potentially carriers. Alright, sabi ni Dom Lacambra, Doc, if yung dog ay long type, dachshund, sabi niya, anong food yung best to give to avoid bone problems in the future? Salamat, Doc. Siguro quick answer, Doc. Ano ba?
Mm. Yes. Hi, Dom. Actually, you can give any dog food naman for your dog. Kahit pa siya long type or
Mhm.
not long type dachshund, 'di ba? So
Oo.
you're asking anong food yung best to give to avoid bone problems.
Oo, pero
For the
i-try nila yung Maxime Prime Dog
Yes,
Diet. See if that would
definitely.
work. Correct?
Yes, definitely. You can use Maxim Elite Dry Dog Food because it has all the nutrients that your dog needs for a balanced nutrition. Hindi lang siya good for bones. Yan, syempre, you should check for the other system of your dogs. But
Mhm.
technically, the Maxim Elite, it has a complete nutrition. All right? So don't worry about the bones of your dogs. If you're experiencing something, go ahead and check with your veterinarians because there are more specific supplements for that. All right.
Correct. Correct.
Thanks, Dom. All right. I
Yan.
think we're through in the puppy stage, Coach. No, we are now going to our lesson number two. It's
Right.
the adult doggo healthcare. All right, we have two topics. How often should we take our doggos for checkups? And of course, konting preview lang sa common ailments ng adult doggos natin. Okay, let's start with how often ba kailangan ng check-up ng ating mga doggos?
Ayan. How often, Doc?
Okay, next slide please. Ay,
Ayan, sige, tingnan
sir,
natin.
sir,
Teka, yeah.
sir.
Ayan.
Ay, okay, yan, alright. So, dogs need check-ups too. Okay? Kailangan din nila, hindi lang tayo. So for adult dogs, we considered adult yung mga 1 year old to 6 years old. So again, depending pa rin to sa breed type, right coach? If it's
Mm-hmm.
large breed, medyo shorter ng konti. We can consider a 5-year-old as uh, junior adult. All
Mm-hmm.
right? So for adult dogs, yes, we recommend yearly. Yes, we recommend yearly checkups for adult dogs. This usually happens during the first booster shots of the doggos, 5-in-1, or the anti-rabies. Okay, it's either the booster for 5-in-1 or the anti-rabies. Di ba makikita natin kanina sa, excuse me, dun sa ating chart kanina that
Uh-huh.
uh, they have yearly booster of their vaccines, right? So,
Right.
dun na siya sinasabay usually ang physical checkups ng aso natin. But if we missed that part, we can always schedule a yearly checkup with our veterinarians. Pwede naman yun. Kahit hindi sabay sa vaccination. If you think it's too stressful for your dog to be checked up during the booster shots, you can opt naman to hindi gawin yon. But you need to schedule it for another appointment para magawa namin yung checkups namin for your dogs. Alright? So ano nga ba yung ginagawa natin during checkups? These four are the general things that we need to do. Pero this doesn't limit this to the 4 lang. So meron pa kaming pwedeng gawin depende sa magiging result nitong apat na 'to. Okay? So first, thorough head to tail physical exam. So eto na yung palpation namin. We'll check them if they have anomalies on the
Mm-hmm.
surface of their skin. Okay, if check namin if meron silang fleas, ticks, something like that, or any deviation from the normal structure of their body. So we'll take note of that. And then second, we'll collect blood sample for blood parasite, of course, and for a complete blood chem. So why do we need to check that? Because adult dogs now has separate kind of diseases na more prevalent for them. So for us to check on it, we need to check internally. Okay, so for us to check it, we need to collect blood samples for blood parasite and to check if the normal level pa yung kanyang blood chemistry. Alright? Next is collect stool for fecalysis. Ito yung diniscuss natin kanina to check naman for internal parasites na makikita natin sa kanilang intestine. So, paano natin makikita yon? Again, we will get fecal samples, we'll check it under the microscope, we will check for protozoans, and we will check also for worm eggs. Alright?
Mm-hmm.
Then, fourth, of course, we will prescribe maintenance medications to your dogs and supplements if needed. So, if upon our checkup, ito yung need ng dogs nyo to recover from certain illness or to recover from certain discomfort, magbibigay kami ng, we will prescribe you maintenance medications, supplements, or prescription diets like that. So technically, ito lang yung general approach natin to check your dogs. Okay?
Right. And just one note coming
Mhm.
from a dog training perspective, okay, before we
Yes.
move on to the next topic. It's very important, again, as young dogs, sanayin nyo na sila to be handled by your vet. So, sisimulan nyo muna from head to tail, checking their paws, while giving them a treat. Make sure that during checkup, they feel comfortable. Kasi may hirapan din naman yung mga friends natin na vet to give the best advice. Kung hindi nila mahawakan yung aso nyo or kailangan pa ng mga dalawang tao, tatlong tao para lang i-check because some dogs would be very stressed then, which would probably also give a different result dahil sobra silang stress. So kaya baka hindi talaga
Yes, definitely.
makuhanan ng dugo for the blood chem dahil stress sila. So make sure that you get your dog socialized and then get used to husbandry or handling of your dog. Yun lang.
Yes, definitely. If your dog is aggressive, as vets, we cannot actually do our physical examination properly. So we might miss things along the way, and that might affect our judgments on your
Mm.
dog's physical health. All right. So next ating pag-uusapan is the common ailments. Okay, first stop is heartworm, 'di ba? So
Heartworm.
inuud po yung puso. Masakit. Joke lang. So for this one, guys, it is caused by a parasitic worm called Dirophilaria immitis. So, saan nga ba nanggagaling tong mga Dirophilaria immitis na to? Charan! It is transferred from dogs to dogs through mosquitoes. Alright?
Lamok.
So, lamok po. So, heartworm disease is a serious disease that results in severe lung disease, heart failure, and other organ damage, and could lead, of course, to death.
Yes, naka-experience
Okay.
na ako ganito na nakitang
Oh,
dog
yes, coach.
na meron siyang heartworm disease,
Mm-hmm.
and the dog, iba yung boses nila because they can't barely bark.
Yes,
Parang
it's
lagi
super
silang
common.
nahihirapan huminga.
Mm-mm, definitely.
And parang there's really no cure. Pero meron mga treatment, I think, right? Pero
Yes, we
mahirap
have.
magkaroon nito because napaka-dangerous para dun sa
Mm-hmm.
aso. So, ano bang itsura nitong heartworm na to, Doc? Alam ko itsura eh, pero
Mm-hmm.
from your experience, nung nakakita ka na ba ng puso mismo ng isang aso, bakit tinawag na heartworm?
Yes, back in college, we have actually actual specimens of heart that is full of worms. So, yung heart, imagine the heart, when you cut it, lalabas yung mga spaghetti straps. So
Oh.
that's, yeah. Kung ma-imagine nyo yun, ganun na ganun siya. Walang pagkakaiba. So para lang siyang spaghetti na lumalabas sa puso. So that's how how big it can get. Alright? Nadadiagnose to ng mga veterinarians when they'll do blood smearing. Then we will check it under the microscope and we will observe a small, parang kitikite na
Aha.
movements on the blood. Yan. So, yun yung mga Dirophilaria immitis. So, sila yung mga worms na nasa bloodstream pa lang natin. Sila yung baby worms pa lang that can can grow that can grow and ayun, mag-infect dun sa heart ng aso natin. That could lead to several organ damage, hindi lang yung heart. Because of course, if
Mhm.
affected ang heart, affected na lahat ng organs ng aso
Right.
natin.
Kaya nga dapat
Definitely.
ingatan ng puso ng mga
Oh,
dogs nyo. Hindi lang
ay
yung
dogs
sarili
pala.
nyo.
Yeah. Tama. Ang puso ng tao at puso din ng inyong mga
Oo,
aso.
oo.
Bawal
Mahirap
ang
magkaroon ng
heartbroken.
sakit. Oo.
Yes. Okay, for the symptoms natin, eto. Next slide. Yan. There are four classes, coach, for this one, or stages of heartworm diseases. So the higher the class, the worse the disease and the more obvious symptoms. So for class 1, ito yung observable symptoms. Actually, no symptoms to mild symptoms lang siya, such as occasional cough. So if may occasional cough siya, feeling natin it's just normal, it's just allergy or it's just respiratory disease, hindi natin siya agad iisipin na, okay, heartworm pala to. Not unless nagkaroon ng screening si vet. Di ba? So, on class 2, medyo nag-progress siya ng konti. From no symptoms, mild to moderate na siya ngayon. Such as occasional cough and tiredness after moderate activity. So, we can actually observe naman to sa mga dogs natin na nangihina sila. Pero hindi pa naman sila old dogs.
Mhm.
Di ba? After activities, hindi na sila ganun kasing active as to before. Then they have several coughing. So, yan, pwede natin siyang it can be suggested of having heartworm. So we can consult the veterinarian and she or he can conduct a screening for this one. All right? For class 3 naman, it is more severe symptoms such as sickly appearance, a persistent cough, and tiredness after mild activity. So yung occasional coughing niya, it progressed to a more persistent cough. So
Mhm.
madalas na ang kanyang pag-ubo and mas evident na yung tiredness after a mild activity. So kung feeling, di ba yung mga pinapa-exercise natin sa mga aso natin, hindi naman ganun ka-heavy, pero
Aha.
sobra yung pagod nila and then there's a persistent cough, we can actually suggest na dapat itong ma-recheck for heartworm. Okay, so upon checking, ayan, makikita natin na there are worms on the bloodstream. So for class 4, it is also called the Cavell syndrome. So there is such a heavy worm burden that blood flowing back to the heart is physically blocked by a large mass of worms. So ito na yung pinaka-severe,
So if
right?
kung meron tayong heart tapos yung meron mga vein, meron physical
Mhm.
block talaga na meron ng worm mismo dun sa
Worms.
mga veins na yon?
Yes, coach. Ito na yung severe case na 'yon. So hindi lang siya sa heart, nando'n na rin siya sa mga veins and arteries, yung mga worms na 'to. So physical block siya na hindi na makaka-pass through yung blood. Hindi naman sa hindi makaka-pass through but minimal blood flow lang siya. So if may minimal blood flow ka lang, it will really affect your kidney, your liver, your lungs. All right?
Wow.
Yeah, that's how severe it is.
So when you say heartworm, it it doesn't mean that we limit the worms dun lang sa heart. It can
Yes,
actually go through other organs of the
it
dog.
can, but it's medyo hindi siya gano'n ka-typical actually.
Ah,
Pero it's on
okay.
the veins, it's on the bloodstream, it's on the heart. It's
Chances of
most typical in the
survival,
heart.
doc.
Depends on the class actually nung symptoms and depende pa rin siya, again coach, this is case-to-case basis, eh. If na-diagnose siya on the later stage, chances are we can't do anything about it, 'di ba? Worms are getting bigger. You
Mm-hmm.
can do surgeries for this, but the prognosis is very low. Okay,
Mm-hmm.
so the tendency is the dog might die lang din.
Oh,
So
yan.
that's again, prevention is always better than cure. That's
Merong
why
comment si ano, doc, si
go pa.
Scarlett James lang. Let's see if we can
Oh, hi
flash that.
Scarlett.
Pero ang sabi niya, may treatment pa ba ang class 4 heartworm, doc?
Technically, mukhang mahihirapan na tayong mag-treat. But of course, for veterinarians, we will do our best to treat that. Pero we can do a treatment for that naman. We have
Alright.
available treatment plan for that, but of course, it's very risky because it's on the fourth stage, that's fourth class.
Mm,
All right. For the treatment plan, okay, next slide, please.
ito
All
na.
right. Of course, heartworm can be treated. So there are several medicines that your veterinarian can give and administer to your dogs to cure and eradicate the heartworms. So costly, of course. Yes, it's expensive. Kaya nga prevention is always better than cure. So a lot of veterinary clinics are actually having is including this program to their to their checklist,
Mm-hmm.
heartworm prevention program. So, marami akong mga friends na may veterinary clinics that they include this treatment plan or this preventive plan to their health program, to their dogs, so that ma-prevent na yung pagkakaroon pa ng more severe cases of heartworm. So, nagkakaroon sila ng routine checking of blood to check for the uh, yung filaria worms para makita nila if present pa or not, mga ganyang cases.
Alright.
So I think it's best to consult your veterinarians to check if they have this program or if they are doing this program or what are the treatment plans. So for you to avail that to prevent, of course, yung pagkakaroon ng heartworm ng aso ninyo.
Nako, kaya mahirap mag-alaga ng aso because you have to really take good care of them from puppyhood to adulthood and eventually geriatric or senior stage. So,
Yes, definitely.
maraming kailangang malaman. And working with your vet is the best place to get these
Yes.
information.
Yes, definitely. We will answer your questions, all of your questions.
Mhm.
Basta lang, you will answer then our questions upon checkups. All
Oo.
right?
Kaya pumunta muna kayo.
Yes, punta muna kayo sa amin because
Oo.
we will help you all the way.
All right.
Yes. Okay, so from one ailment to the next, please. So we're going to talk about leptospirosis. So
Mhm.
ito dapat na pag-uusapan natin to because lalo sa bansa natin na maulan and very very prone sa flooding. So
Right.
Yes, for leptospirosis, it is a disease caused by infection with leptospira bacteria. Alright? This bacteria can be found worldwide naman siya. So, in soil and water, hindi lang sa Pinas. So, it is a zoonotic disease. So, guys, zoonotic disease means this disease can be transferred from the animals to us, humans, and
Oh,
can be transferred from humans to animals. So that's the zoonotic disease means. Okay? So, leptospirosis is more common in areas with warm climates because high annual rainfall ang meron sa atin, but it can occur anywhere naman. So, mas common lang siya to occur in the countries like us na talagang madalas yung ulan. Alright?
right.
So, for the symptoms, next. Okay, let's check for the symptoms for
Yeah, siguro,
leptospirosis.
Doc, because we're
Yes.
almost out of time, pero let's run through the symptoms.
Yes, yes, yes.
Tapos, mag-share lang tayo ano ba yung pinaka-worst na, na experience mo na kaso with leptospirosis.
Yes, definitely. Well, general lang naman yung symptoms nito. It has fever, shivering, muscle tenderness, of course. Pero yung pinaka-common is the jaundice or yung yellowing of the skin and mucous membranes. Of course, there's pain, inflammation within the eyes. Ang experience namin dito, madalas din tong case na to during rainy season, of course. There's jaundice na no dinala sa clinic. It's actually medyo ano na 'to, medyo severe na. So, the prognosis is quite low pero it can still be cured.
Mm. So, Doc, yun explain lang natin yung yellow of the skin and mucous membranes. Ito yung dun sa bandang, di ba? Sa bandang gums.
Sa
Dun yung
gums, yes.
tine-check.
Sa
Dapat
gums.
medyo yellowish na siya.
Mm.
Hindi siya yung normal na parang pink. So, pag medyo na yellowish siya, so that's already a sign of lepto. You just have to
Yes.
confirm it with the test. Tama?
Yes, definitely. Pero of course, we won't want to, umabot na sa gano'n bago natin
Uh-huh.
ipa-check. Alright? So
Okay.
basta, if nag-start na siyang magkaroon ng fever or inappetence, i-check na natin agad sa veterinarians because we have testing kits for that. Okay?
Yes. And meron tayong
Yes.
vaccine. Ayan, vaccine na naman.
Yes,
Para doon sa
definitely.
mga anti-vaxxers talaga. Ako, ayoko talaga ng anti-vaxxer kasi how can
Mm.
we prevent, di ba, our dogs from getting sick without a vaccine? Same thing with humans. Marami kasing fake news ngayon na anti-vaxxers, pati aso dinadamay na. No? Pero we
Yes,
also
definitely.
have these vaccines. Yes, mahal. Yes, of course, the big pharmas can make money out of it. Pero hindi naman lahat. Wag na tayo masyadong maniwala dun sa mga fake news at wag din tayo masyadong maniwala sa mga kuro-kuro na hindi naman mga professionals yung nagsasabi. 'Di ba? So maniwala kayo sa vet. Maniwala din kayo sa akin as a professional dog trainer.
Yes,
'Di
tama.
ba?
Mm.
Oo.
Yan, coach. Thank you for that. No, prevention is through vaccination, guys. Nasa 5-in-1 yun. If you want a more specific discussion for leptospirosis, you might want to check our second episode of Maxime Talks. All right? Okay, I think we're done with the adulthood coach, no? So we're
Eto na.
moving now for the Grand Doggo Healthcare. Ito rin from mga geriatric. So we have four topics on this one. Una yung checklist for Grand Doggo Care. Second, changes that is actually observable for geriatrics, the common ailments, and the clinical signs to look out for our old dogs. All
Mhm.
right, let's start with the checklist or how to care for our old dogs. Of course, first is age-appropriate diet, right, coach? So older dogs are at higher risk of developing obesity during this stage of their life. Kasi medyo mabagal na silang gumalaw, so
Oo
the
nga.
tendency is, 'di ba, coach, hindi na sila masyadong active, yung kain tulog na lang sila. So that's a very 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 good activity for promoting obesity, right, coach? Have you experienced a dog with obesity before?
Yes, yes, a lot, and we have to encourage them to to take a slow walk, just any movement para magkaroon pa rin ng kahit na konting exercise. Yan sabi ni Ayn Lorenzo, what age do we consider a dog a senior or geriatric?
Actually, ito yung pinag-usapan namin ni coach kanina, it depends upon the type of dog. Usually, 'pag sinabi natin na large breed dogs. We can consider senior dogs on the seventh year to
7,
10th
8
year.
pataas?
Yes, 7 pataas siya, usually. Pero
Mhm.
that's the average of all dog breeds naman.
Mm.
Yeah, thanks for that question. All right. So we can continue now with the how to care for all dogs. Next for the diet is regular exercise. Of course. So, this
Yes.
will help your dog maintain their ideal weight. Pero, tatanungin nyo, ano bang exercise? Eh, di ba old na siya? So, what we can recommend is just regular walks sa umaga or sa hapon. If they can still run, pwedeng konting jogging din, of course. Importante din na namove natin sila regularly of course, to prevent obesity. Katulad nung una natin pinag-usapan kanina. Right, Coach? Ikaw,
Right.
Coach, paano mo ba ina-exercise yung mga senior dogs mo?
Well, yung mga regular walks, tapos we also not just focus on this physical, pati yung
Mhm.
mental health din nila, tsaka emotional health. We give them stuff, yung mga interactive toys to do. Pero para sa akin, ang paborito namin is swimming. So,
Oh,
sa ngayon, hindi kami makapag-swim, hindi kami makapunta ng beach kasi nga
yeah.
lockdown o kaya bawal. Kailangan pa ng visa. Kung pupunta ka lang ng beach, visa, ibig sabihin kailangan mo ng mga permissions, mga rapid tests. It's really complicated now. Pero hopefully by 2021, mas may encourage din natin, no? When you go to the beach, bring your dog. Or maybe you have a pool. Or baka pwede kayong gumamit lang. Meron kayong mga nabibili dun sa mga pet stores na mga pang kiddie pools.
Mhm.
Ah, kung small lang naman yung dog nyo, encourage nyo silang mag-paddle. Kasi sa palagay ko, it's great for their joints dahil as they age, sumasakit din
Yes.
yung mga kasukasuan nila. Lalo if you have a big dog and they are prone to hip dysplasia, which is
Yes, that's right.
common then for senior dogs.
Definitely. Yun, you can use those advices that coach give us, okay? So next natin coach is regular vet checkups. So
Of
dito na
course.
pumapasok. So kung kanina sa mga adult dogs natin it's once a year. For our geriatric dogs, we recommend to do it regular checkups once every 6 months. So twice a year. So why? Kasi mas mababa na immune system ng ating mga geriatric dogs. So, dapat mas watchful tayo on any flares pagdating sa ailments na nangyayari sa katawan nila. So,
Mm-hmm.
regularly, you should do it every 6 months. Alright? For next naman is maintain oral health. This is very important because to keep your dog's teeth healthy, so ano nga ba yung gagawin natin? You need to wash them every day. And if your dog isn't a fan, because a lot of dogs are not fan of brushing their teeth, start giving them dental treats. There is a product for that. I'm not gonna say the
Mm-hmm.
brand, but there are, okay? Then, take your dogs to a vet once a year in order to have their dental prophylaxis. Okay? Meron na. A lot of veterinary clinics now are offering dental care, dental prophylaxis, and dental cleaning to your pets. So you might as well engage then on the dental or oral health of your dogs and schedule an appointment to your
Right.
veterinarians.
And
Right?
note lang siguro, Doc, real
Mhm.
quick, when you're giving dental treats to your dog, mas
Yes, that's right.
maganda bumili kayo ng medyo branded. Huwag yung mga parang walang brand kasi you won't be able to
Yes.
test or parang wala kayong habol. No? Kung medyo defective pala yun, your dog might get a bad tummy ache, baka magkaroon ka pa ng problema. And then when we're talking about dental treats, huwag kayong magbibigay ng mga cheap uh, rawhide kasi there has been enough documentation na yung mga rawhide na binibigay usually for the dogs to chew on and then try to clean their teeth is actually bringing more harm.
Yes,
No, so you
definitely.
can read about it. It's actually a topic for a different discussion. Huwag kayong magbigay ng mga rawhide. Find something else. Yung sinabi ni Doc na hindi niya mapangalanan yung brand, get that. Kasi at least yun, branded yun. Pwede mo silang
Yes.
habulin, no, kung mayroong problema. Tapos, yun dun sa prophylaxis, your vet would be the best judge
Mhm.
kung kailangan ng aso nyo. Huwag kayong pumunta doon,
Yes,
Doc, I need my dog some
definitely.
prophylaxis kasi meron naging issue
Case,
viral na nagrereklamo yun yung pet parent kasi
mhm.
nagkaroon ng prophylaxis and the dog hindi niya kinaya yung procedure, no. So
Mhm.
you should also understand na there are always risk with everything. Kahit na magbigay
Yes,
lang kayo ng
definitely.
dental treats, meron risk yan. When you bring
Mhm.
your dog to a vet for oral prophylaxis, meron din risk yan. So,
Yeah,
it's
yes.
best that you get yourself informed na wag niyong sisisihin yung vet or kung sino man um, just because you're not informed. So that's why we're having these Maxime Talks para everybody have that chance to be informed.
Yes.
And then you can also get your friends informed by sharing our live stream. So even na matapos na yung live stream natin, i-share nyo doon sa mga friends nyo, sa mga dog groups nyo. Please, because that's one reason why we're doing this. Of course, this is sponsored and powered by Maxime. Pero guys, ang pinaka-importante dito, why Maxime is doing this is education. Lalo-lalo na ngayong Christmas season, ang dami magkakaroon ng puppies. I'm predicting by 2021, sometime around February, March, meron ng mga aggressive na aso. Meron ng mga asong may sakit. So please share our live stream. Yun lang.
Yes. Thanks. Yes, tama, tama, coach. All right. For next naman, of course, for vaccination and parasite protection, hindi natin dapat yon aalisin sa medication program ng all dogs natin. Even if they're old, they still need the parasite protection. All right? Pero when it comes to vaccination, minsan, case-to-case basis, older dogs do not actually require them at the same intervals. So usually once every 3 years is enough for senior dogs. Pero that's again case-to-case basis. So you have to consult your vet since they will know what is the best for your dog's individual needs.
Mm,
Because not all dogs are the same. All
of
right?
course. Doc,
Definitely.
meron tayong isang question na nakuha.
Okay.
Uh, I guess it applies from puppies until senior. Sabi,
Sure.
what should we do if my dog had an allergic reaction to vaccine?
Usually nakikita na to, di ba, on the first vaccination pa lang. There are several brands of vaccines. So, if ang nangyari na ito on the first shot pa lang, definitely you have to bring it back to the veterinarian, to the veterinary clinic, and they will administer a specific medicine for that allergy. And further on, for the next vaccination, they will change the brand for that
Mm,
vaccine. Ganun yung nangyayari because we need to rotate it para din hindi ka na para hindi na siya ma-allergy on that specific brand. Kasi may mga
okay.
ganong cases and that's how we manage it.
That's why it's best na wag kang parang patalon-talon ng vet kasi yun bagong
Definitely.
vet, baka hindi niya naman alam yun medical history ng
Yes.
puppy nyo o ng dog nyo. So, mas maganda rin that you keep all the records. Minsan kasi
Definitely.
nawawala eh, di ba? So,
Yeah,
dapat
yun yung
itago
problem
natin yung
sa
medical
pet parents
records.
minsan.
Oo.
Yes. Yun, I hope
Wonderful
we
question.
answered that question. All right. So next for caring the old dogs is regular grooming, coach. Siyempre.
Grooming! Of
Yes,
course.
definitely. Kailangan pa rin natin silang suklayin because technically less na yung ano nila eh, yung access nila with their bodies because they're getting old, medyo brittle na yung buto so hindi na nila yan kayang kamutin, ganyan, or comb ng sarili nilang po. So we will need to brush them, especially doon sa mga high maintenance dog like woolly dog, mga long
Mm.
coats, right? So,
Mm-hmm.
highly recommended that you use only natural shampoos because why? Why? Because medyo sensitive na yung skin nila eh. Lahat ng pagiging sensitive na sa old dogs na. So technically they are more easier to get irritated skin and coat
Yeah,
during
marami
the
naman
stage
ng
of their
ganyan na
lives.
products ngayon sa market.
Yes,
Actually,
definitely.
marami talaga mga brands. So, make sure na hanapin nyo yung mga organic o yung mga natural shampoo. So,
Mhm.
marami yan. Iba-ibang amoy. So, importante is regular grooming nga. Yan.
Yes, totoo. So next coach natin is provide special accommodation. Of course,
Mm-hmm.
alam natin they are older dogs,
Mm-hmm.
so medyo hindi na gano'n kaganda yung integrity ng bones nila and yung katawan nila hindi na sila kasing active as to before. So what we can do is to provide them soft bedding and
Uh-huh.
easily accessible beddings para hindi na sila magja-jump or magka-climb-climb pa para makapunta dun sa mga beds nila. We could just put, marami naman na ngayon na readily available eh, na cushions na pwede nating
Yes.
ilagay lang sa floor wherein they can sleep. So, parang hindi na
Oo.
sila sasampa pa sa upuan, ganyan, where we usually put them.
Usually
Alright?
naman din, from my experience, yung mga senior dogs, hindi
Mm-mm.
naman na sila masyado nagngangat-ngat ng mga bedding. So, pwede nyo nang ipagamit
Yes,
yan.
totoo rin.
'Di ba?
Tama na, coach. Yan. So, next naman natin are the changes na, actually. Yung mga changes that are actually observable na
Uh-huh.
na-occur during the geriatric stage ng mga doggos natin. So first niyan, of course, is yung loss of cognitive ability na napaka-common with the age ng mga geriatric dogs. So medyo na-out of focus na sila. Medyo hindi na, slow na sila on picking up instructions, right? So hindi na nila, pag sinabi mong sit, minsan ano yun, parang ganyan. So medyo slow
Mm-hmm.
na sila on that part. So second, their skin can become dry and their coat more coarse. So dry na yung skin nila, and pag hinaplos natin sila, medyo magaspang na yung balat nila, or medyo matigas na yung fur, yung coat nila, right? Then
Mm-hmm.
next, obesity is at high risk. So kanina na-discuss natin, at old age, since sobrang bagal na nila kumilos and usually kain tulog na lang sila, obesity is a high risk. So, maraming tumatabang old dogs. Alright?
Ah,
For
so ano
bones,
din, babaan nyo lang din yung kain ng konti.
yes,
Or baka
definitely.
kailangan ng special diet for your older
Mm-mm.
dogs.
For bones and tendons naman, they became more brittle and fragile. So, more prone sila into fractures, something like that, dysplasias, ganyan. So, next ay difficulty in temperature regulation. So, tama ito. So, kung dati, kaya pa nila yung ganito kalamig na paligo, so ngayon dapat lukewarm na lang tayo when it comes to dogos, all
Pati yung
dogos.
tulugan nila, saan nyo nilalagay?
Yes,
Baka
definitely.
air condition kayo, kasama nyo sa room nyo. Maybe that would
Mm-mm.
not be the best place to be. Or maybe you need to lower the room air conditioning. Or maybe when it's too hot, you need to
Mm-mm.
bring them somewhere a little bit cooler. Basta mas maganda talaga, it's room temperature nga, di ba? I think they prefer that. Yun ang observe ko sa mga older dogs ko.
Older dogs. Yes,
Mm-mm.
yes, coach. Tama. And next is they're becoming more sensitive eh. Actually, ito hindi lang to sa health nila, but to their behavior. Tama ba,
Yeah,
coach? Parang
correct.
may experience ka bang ganito na more sensitive na yung geriatric dogs mo?
Most well, I recently lost my Labrador, Sophie. She was 11, so I was proud naman that she passed at 11 kasi we must have done something. Though sabi nga namin, we always wish na we have one more day to have her around us. Pero napansin namin when she started to go into senior stages, around 7, mas masungit na. And now I have a 9-year-old and an 8-year-old. And then I also have 6 years olds now. So yun na yung age group ng mga dogs ko. Mas nagiging masungit na sila. So parang
Yes.
nagiging lolo at lola na. So, yun ang
Totoo.
tawag namin sa kanila. Lolo or si Lola, ayan na, masungit na. So, they might not tolerate younger puppies. And I don't recommend that na parang you mix older dogs and then alone with a younger puppy kasi nai-stress yun mga seniors nyo. Sabi ni Michelle Guerrero, "Hi Doc, can dogs have arthritis? How can joint discomfort in older dogs be elevated?" Ayan. Maganda rin to because
Alright.
na-experience din ng
Bitin
mga
mo.
dogs ko to, Doc.
Yeah, actually, good question yan. And my answer will be discussed later sa mga next slides.
Ayan.
So,
Abangan
ipopause ko
mo.
lang. Medyo hold on lang.
Oo.
Hold on.
Sige, abangan mo,
Alright.
Michelle.
Yes. Okay, last na natin to, coach, sa common changes niya is yung lesser vision and hearing capabilities. So, normal naman 'to na nangyayari, wear and tear ng eye capabilities, vision loss, and minsan nabibingi na rin sila. So, this is quite a normal change that we can actually experience sa ating mga geriatric dogs. So, all right. So, next we have three more topics. First is the tooth decays and
Tooth
gums
decay.
infections. Yes. All right.
Sige, isa na. Ayan.
Yeah. Okay, when a dog is older, the challenge of treating dental diseases escalates, and many fear the risks associated with an anesthesia. Kasi sabi nga ni coach kanina, if kailangan ng dental prophylaxis, kailangan siyang naka-anesthesia, naka-under
Mhm.
sa anesthesia to do the procedure. So a
Mm.
geriatric patient is almost always risky pagdating sa anesthesia. Okay,
Mhm.
there is always that assumption na they might not wake up under
Yeah.
anesthesia. All right, but for the treatment, technically and generally, antibiotic and anti-inflammatory is always given to treat yung mga gum infection. But for tooth decay, usually it's tooth extraction through surgery. Yun nga, kailangan natin siyang iput under anesthesia. But surgery, yun yung sinasabi ko, it is a risk for just geriatric patients. Alright?
Mm-mm.
But outside surgery, we can do these things para naman ma-prevent natin yung pagkakaroon ng tooth decay. So we can do brushing of the teeth, dental chews, and we also have water additives. So you
Yan ang
want the water
favorite ko.
additives. Yes,
Yan yung
coach.
favorite namin, water additive. Lalo-lalo
Yes.
kung geriatric, hindi na sila masyadong
Oo, tama, coach.
nagngangat-ngat eh. So,
Mm-mm.
very subtle. Ang ginagawa lang natin dyan is you just mix that with water and then you
Yes,
give
definitely.
them parang mouthwash na pwedeng inumin. So, I love it.
Yes, medyo less maintenance pa, ano, coach.
Oo.
So, ito na yung answer dun sa question ni ma'am kanina. We're
Yes.
talking about osteoarthritis. So,
Mm-hmm.
okay, slide please. All right. Osteoarthritis is a degenerative joint disease or the wear and tear arthritis ng ating mga joints. It
Sakit sa
occurs
buto.
most Yes, it occurs most frequently in the limbs, hips, and knees dun sa ating mga joints. So, cartilages within a joint begins to break down and the underlying diseases. So, ang nangyayari kasi dyan is that yung mga cartilages between the bones ay nag-wear and tear na. So, nawawala na sila, ganyan, nasisira na sila. So, the tendency is them being the cushion between two bones, ngayon nawala na yung cushion. So, tendency is yung dalawang bones yung magkikiskisan. And
Mm-mm.
it will bring more pain to your dogs when that happens.
Mm-mm.
For observable signs for osteoarthritis, you can see stiffness or lameness or difficulty getting up. So makita mo yan sa mga dogs, hindi na sila masyadong tumatayo, hindi na sila gumagalaw masyado, gusto lang nila nakahiga. And associated na yun yung lethargy or general weakness of the body. Reluctance to run, tamad na tamad silang magkaroon ng outdoor activities or tamad na tamad silang mag-play. Weight gain, because hindi na sila masyadong naglalaro, tumataas na yung timbang nila. Alright?
Right.
Irritability or changes in behavior. Of course, kung sino man yung may masakit na nafe-feel, magiging irritable siya. That's understandable. So, pain when petted or touched. Mapapansin natin na kapag hinihimas natin sila or during the petting sessions, umiingit sila. So, ibig sabihin, there's something painful within that part of their body. So, that suggests actually of osteoarthritis. Difficulty posturing to urinate or defecate, even this can actually happen. So, mahihirapan na silang umihi. Alam naman natin kung paano umihi ang mga asong lalaki. They need to, kailangan itaas yung paa. So, they can't do that because masakit yung kanilang joints. Or even defecate. If yung hip nila is sumasakit, they can actually posture to do that or having accidents in the house. Since medyo malamya sila kumilos, the tendency is pwede sila mabunggo-bunggo sa iba't ibang furnitures natin and could lead to more serious injuries. Then, loss of muscle mass over the limbs and spine. Since hindi nga nila yung nagagamit, the tendency is nagkakaroon ng atrophy. Ang tinatawag natin dyan sa medical term are disuse atrophy. Yung tawag sa isang muscle na hindi na nagagamit kaya lumiliit siya. Yun.
Wow.
All right. Yes, coach.
Right. Also arthritis. Mga dogs ko, senior dogs, nagkakaroon sila nito. Not just my lab who passed, pero even my senior dog now, si Serena. She's a golden retriever. She's not showing signs na she's in pain. Pero yung gait nila, no? Medyo
Yes.
nag-iiba na. So
Mm,
gait, ibig sabihin yung lakad nila,
yes.
kung dati straight,
Pacing.
medyo they're trying to avoid na yung masakit na part, no?
Mm,
So, hindi naman siya totally na ika, pero kailangan nyo bantayan. And itong osteoarthritis, though it's common na nangyayari, malaki din yung kinalaman ng not just age pero yung breeding. Kasi
yes.
meron mga iba, dogs have been bred, parang especially if the dog is coming from a puppy miller, and the dogs are not bred properly, minsan pinapalala yung osteoarthritis na namamana kasi yung nga, pangit yung pagkaka-breed. So, malaki pa rin yung connection, kung tutusin, lahat ng diniscuss ni Doc, from puppyhood until adulthood and then geriatric care or senior. Very important na talaga na magabayan nyo. Uh, Unang-una, keep yourself educated and then magabayan kayo ng isang vet.
Yes. That's right, coach. So let's go now for the treatment and management naman ito. For the treatment and management, minsan dapat multimodal yung ginagamit natin or madaming approach. So hindi lang dapat NSAID, analgesic. So dapat it's combination of
Mhm.
NSAID, analgesics for pain, nutraceuticals for comfort and to preserve the cartilage, nutraceuticals at yung multivitamins, supplements na pwede nating makuha sa veterinarians, and of course, proper nutrition. For example, nutrition or a food that has omega-3 based diet. All right? So just to introduce to
Teka,
you,
meron bang ganyan si Maxime? Omega
nako
3?
coach. Yes, coach.
Ayan pala
Actually,
eh.
I was about to say siya talaga. Yes. That Maxim Elite has omega-3 and omega-6. All right? That you can actually give to your geriatric dogs for a proper nutrition to combat osteoarthritis. Of course, together with the medicines na makukuha natin through consultation sa ating mga veterinarians. And fifth and sixth is yung weight control or weight loss. That's very important. And of course, if we want to go to physical therapy, we can always consult a veterinarian for the most appropriate procedure for that. All right?
Ayan.
Yes.
Pinapasabi ng mga mga producers natin, Maxime and Maxime Elite is available in Lazada and Shopee with great discounts await you. Shop now. I think this is for the Lazada 12 sale. So that's Lazada and Shopee. So check that out.
Yes. Okay, coach. Down to our last two ailments, we have lumps and bumps. So as our dogs ages, they often develop spongy lumps called lipomas, no? So on their bodies, on the surface of their body. So these lumps are usually fatty tumors, but not that cancerous one.
Mm-mm.
Pero minsan they can be cancerous and minsan they are not. So commonly found on the trunk ng ating mga aso or the sa body nila. So minsan cancerous ba siya? Yes, it can be cancerous. So what to do? Of course, we should not panic if we found a lump or a bump in our dog's on our dog's body. What we can do is to bring her or bring your dog to the veterinarian, and of course, the veterinarians will conduct the test or biopsy test to confirm if your dog's lumps or yung mga bukol na yon is cancerous or not. And if it's cancerous, there are management or health management programs that your veterinarians can suggest to you, from surgeries to chemotherapies, available na yan sa mga veterinary clinics. And they can
Mm-mm.
actually help you with that. Coach, have you experienced one of your dogs to have this?
Si si Serena, meron siyang parang bukol, pero it goes away. So we immediately ask our vet kung ano yon. And sabi, obserbahan lang muna because it wasn't really growing naman. So it could
Mhm.
be because of skin tag, because of the age na rin. And then it could be also yung mga fat deposits lang yon, lalo na when they're gaining weights. Pero wag
Yes.
niyong mamaliitin itong mga lumps na to. When you're in doubt, always consult with your vet. So, paulit-ulit kami ni Doc dito, no? So, yung mga lumps na to, yes, nakakapraning minsan. Pero wag ka agad-agad. No? So,
Hmm.
you need to do your research and then ask the proper professionals for that.
Yes, that's right, coach. All right, down to our last topic for today. It's about pyometra. So with this,
Pyometra!
yes, it's a secondary bacterial infection that occurs as a result ng hormonal changes sa female's reproductive tract, no? Nagtitiken yung kanyang endometrium o yung wall ng kanyang uterus and becomes cystic lining, secretes fluids that create an ideal environment for bacterial growth. So after many years ng estrous cycle kasi without pregnancy, yung uterine wall may undergo changes that could actually promote this disease. And this is very common sa mga adult female dogs. All right? So ano nga ba yung mapapansin natin or symptoms for this one? So we have two. We have the closed and the open pyometra.
Oo.
Okay? So, tinatawag lang siyang open pag yung cervix ay naka-open during this disease infection. So, what we can do, ay with what we can observe is that pus will drain, pus, Tagalog, that's nana, no? So, pus
Uh-huh.
will drain from the uterus through the vagina on to the outside. So, nagdi-drip siya, makikita natin yung pus. Okay? So, pus or an abnormal charge is often seen on the skin or on the hair, under the tail, on the beddings, and the furnitures where the dog has recently laid. So,
Mm.
of course, there's fever, lethargy, anorexia or inappetence, and of course, depression may or may not be present. Pero most often, meron yan. Then, next naman is the closed pyometra. Of course, this happens when closed yung cervix and mas dangerous ito kasi hindi natin siya nakikita. So, hindi natin napapansin na meron na palang pus sa loob. Ang alam lang natin, lumalaki yung tiyan niya. So, the pus that forms is not able to drain to the outside. It collects in the uterus, ultimately causing the abdomen to distend. So, malaki yung tiyan. The dogs with closed pyometra became severely ill very rapidly. They are anorectic or wala silang ganong kumain, very listless, very depressed. Vomiting and diarrhea may also be present. So bakit mas dangerous to? Because the toxins that are being produced within the uterus ay na-absorb sa system ng body, sa system ng katawan ng aso. So nagiging systemic infection siya, nagiging infection sa blood ng tao, nung aso. That's why mas dangerous ito kumpara doon sa open pyometra. So for the treatment, the only treatment for this, the preferred treatment is to surgically remove the infected uterus and ovaries by performing an ovariohysterectomy or spaying. So intravenous fluids are required to stabilize, of course, yung dog and kailangan siyang magkaroon ng ma-confine for a while para
Got a question, Doc.
makarecover.
Kasi si
Yes, coach.
Sophie, yung lab ko, ito, since last topic na natin to, pyometra, nagkaroon siya ng open pyometra. No?
Yes, coach.
So, baguhan pa lang ako na dog trainer noon. Napansin namin, kasi hindi namin siya pinapa-stud eh. So, wala kaming planong mag-breed. She had this open pyometra. Yung nga, nagkakaroon ng secretion ng pus. So, tama din yung
Yes.
sinasabi mo dito na nagkakaroon ng treatment ng antibiotics. Pero even that, sometimes will not work. Ang ginawa sa kanya is yun, siguro babanggitin mo sa susunod na slide, pero ang ginawa sa kanya is surgery. Pinakapon siya.
Yes.
No? Pero
Yes,
yung
that's
nga,
actually yung preferred the treatment, coach, for this case.
okay. So, sorry
Mhm.
marami kasing hindi nakakaalam. Sasabi nila na, okay, ayoko magkaroon ng pyometra. Familiar na ako sa pyometra. Ayoko magkaroon ng pyometra yung aso ko. Ipapastud ko na lang siya ng ipapastud. Or pwede ba siyang ipastud ko lang ng isang beses? So does it mean pag nanganak na yung babaeng dog, hindi na siya magkakaroon ng pyometra? Di ba? Meron pa din risk?
Yes, hindi yun assurance na na ibig sabihin na stud na yung aso is hindi na siya magkakaroon ng pyometra. Wala pong gano'n na assurance. So,
Mm-mm.
kahit pa makapanganak siya ng isa, wala o dalawang beses, it can still get this infection. Alright?
Mm-mm.
So, wala pong assurance.
Kaya ako, I am an advocate of getting a male dog or a female dog spayed and neutered. If they are
Yes.
at the right age and then you have no plans of breeding them, 'di ba? Prepare for the future na lang. So I guess that's the best case na lang. Huwag niyo nang isipin na gusto ko pa kasi magkaroon ng apo or anak yung aso ko kung hindi rin naman planado yun pagbi-breed ninyo. 'Di ba? Protect your dog na lang. So pakapon niyo na lang din. So meron din naman mga benefits. No? So for male dogs, ibang usapan. Pero for female, lalong-lalo na sa female, huwag niyo nang hintayin because this can be very dangerous din para sa dog niyo. And every time na
Yes.
mayroon din mawawala na aso, just like Doc Ron, dudurog din ang aking puso.
Totoo yan. Masakit. Mahirap mag-move on. So, lalo pag pet mo. So, yun, Coach, I think that's our last topic, no? And this ends our session for today's Maxime Talks. All right,
Mm.
so, okay, well, just a quick announcement to our dear shopaholic pet parents out there. You can get a chance to have your pet's wishes granted at our Shopee and Lazada's 12/12. All right. Add to cart na. Shop and get good discount deals for all Maxime and Maxime Elite products. So bring goodness to your dog's palate. All right. I guess that's it for today, Coach. Sobrang thank you and for joining me for today's episode, Coach.
Thank you
Any
rin
last
po.
ano
Thank
po?
you. So please follow us on our social media pages. That would be on Twitter, Instagram, Facebook, and also on TikTok. So that's
Oh,
at Dog Coach Francis. Hindi ako sumasayaw doon ha, yung mga dogs ko. Okay. Um, and then please don't forget to listen to our podcast, The Dog Behind the Human. Okay, hanapin nyo yan. They're available on Spotify, on Apple Podcasts and Google Podcasts, and any other podcast streaming platform that you listen to. So that is The Dog Behind the Human. This is powered by Maxime. All right. So
yes.
siguro takeaway ko na lang before we say bye for this very information filled Maxim talk is no matter what age your dog is, it's important that you work with your vet, with your pet professional, whether that be your dog trainer or your dog groomer, because sama-sama lahat yan in trying to keep your dog safe. And iwasan natin talaga yung pagtatanong kay Facebook, because you're never gonna get the right answer. You will always need to have the proper tests done right, and wag na natin though experience is the best policies, or is parang the best way to learn, 'di ba? The best teacher daw is experience. Wag niyong i-risk na magkaroon pa kayo ng bad experience para matuto kayo. Learn from the professionals na matuto na kayo doon sa mga napagdaanan namin. Ako as a professional dog behavior consultant, and kay Doc Ron as a vet. Kasi kung hindi man namin napagdaanan, nakita na namin yan. So, kaya tayo nagkakaroon din ng mga Maxim Talks para i-share yung information na natutunan namin over time. So, that's it for me. Doc, maraming salamat din. This has been Dog Coach Francis. Keep safe, keep healthy, and don't forget to pet your dog. We'll see you the next one.
Thank you, Coach. No, so once again, thank you for tuning in for today's episode. And to catch up all the past episodes, please visit our Facebook page at maxim.ph. And don't forget to like, share, and subscribe. Please watch out for the next episode of Maxim Talks. And this has been your host, Dr. Reniel Montero, reminding all pet parents out there to always do good for your doggos. All right? Thank you and bye bye.